I would like to welcome the Honorable Vice Chancellor, Dr. Madhuri Kanitkar, at any point that she can join us. Unfortunately, something has come up and she has had to be present for an urgent meeting, but she is going to try her best to join us for this launch event. And we may have to move the program slightly around so that we can ensure that we get the privilege and honor of listening to her speak. But if not, if there's something that comes up and we can't have her, we do have a pre-recorded video where she's very kindly taken the time to
She has just said
address.
she will join. Sanjay, she just pinged saying she'll join in 15
Oh,
minutes.
fantastic. Within 15 minutes. Excellent. So, but for the record, I'm welcoming her already. Now, just moving on, let's start with a brief survey. So on your screens, you will see a poll that will come up, and it just asks a question about your interest in Prem Seva. And so please answer, and I'll give you just a minute or so to answer. And I'm going to share the results on the screen. Excellent. So we've had 44% people saying they care for or have cared for a senior person, 38% who has a friend or family who care for a senior person, 24% who actually provide a senior care service, and 50% are here because they're curious. That is brilliant. I mean, we've got such a nice mix of people in the audience. So I'm just going to go back to my slides. So at the beginning, there is a quote that sort of comes to mind, and that is, life is fleeting, but ideas, inspiration, and love endure. So the idea is Prem Seva, the inspiration was our late mother, and love is what makes it all happen. So when my mother was still alive, I read Atul Gawande's very insightful and honest book, Being Mortal. And it's written on a topic that a lot of us don't want to address, don't want to talk about, don't want to discuss. It's the elephant in the room. But one of the things that I read in that book, and my mom read the book as well, but she was still alive, and I passed the book on to my brother after she passed away. And it taught me that in India, there is still something that we are getting right. And that is, a lot of the times senior people are living in their own homes and being looked after by the family, which is not the case in a lot of Western countries. Sadly, this is changing, but I think we have a lot of very good foundations to start working on. And what struck me about my mother's care was that the paid carers who were looking after or who were employed to look after senior people needed skills to be able to do their job properly. And families could not undertake this challenging task without any support. And that's why we came up with the idea of Prem Seva. I then reached out to, after my mom passed away, I reached out to Professor Clive Bowman, Professor of Gerontology at City University London, and one of the editors of the Care Home Handbook. The Care Home Handbook was a book I did not know anything about until I contacted Dr. Sadia Ismail, who's one of the members of the advisory board. She's a consultant pediatrician in Leeds. And she sent me this big tome, which had a wealth of information in it, written specifically for workers and carers in care homes in the UK. Professor Bowman has been very generous with his time and his advice, and has been a real support during this project, and he's one of our directors. I now invite Professor Clive Bowman to say a few words about home care for the elderly.
Hello, everyone. I'm Clive Bowman, and I'm a doctor, as Sanjay has said, with some international experience of aging and care. And I'm delighted to set the scene for the launch of Prem Seva today. But at the outset, I would like to pay tribute and congratulate Sanjay, Shabada, and their colleagues who have worked so hard to bring the Prem Seva project to life. So I'd like to set the scene and explain our intention and it's that Prem Seva will offer an important resource that could transform the care of frail older people through supporting those organising and providing their care. Now, as doctors, we diagnose and treat our patients, and together with our nursing and other professional colleagues, collectively contribute to a patient's experience and outcome whilst under our care. For people with continuing personal care needs, when they return home care becomes the ongoing responsibility of others, typically family, friends, and paid carers, who often have little or no experience or knowledge of the how or what to do. Now, a very long time ago, when I was a consultant physician and gerontologist in the NHS, I had an excellent team of specialist nurses and therapists, and one of their key functions was to enable the discharge of patients home, which often meant training family and friends to provide care basics. We extended this to care homes where at the time those same skills were often limited. And one of the learnings from all this was, whilst there may be a number of ways to provide care for frail and vulnerable people, consistency is part of ensuring safety. Now, I know these days in the UK, such services are often impossibly overstretched, and internationally they may not be well developed. The result is that wherever you may live, the often simple but essential skills people needing care require are simply not easily accessible. With the ageing of societies across the globe, this is a growing challenge we all confront. Now, just for a minute, imagine boarding a plane and learning that the pilot has not flown before and did not have access to training or operating manuals. I guess, like me, you'd be disembarking with some urgency. Well, that is not so dissimilar to the situation confronting older people needing care, but quite simply, they can't jump ship. Families in India will want to provide or ensure the care of their elders is safe and sound, but where to start and how to do it are the challenges Prem Seva seeks to address. Yes, you can Google and YouTube, but you will struggle to find a considered and coherent approach that provides a professionally developed flow of assessment of need and guidance on how to provide care. Now, digital solutions have increasingly supported many long-term conditions, most recently in the mental health area. But the space that Prem Seva is targeting is underdeveloped, which makes this an exciting and important proposition. And I hope you will share our enthusiasm for the project by the end of this launch. I thank you. If I hand back to you now, Sanjay.
Thank you so much, Professor Bowman, for those very kind words and also giving us an international perspective on a very important issue. I now invite Dr. Shubhada Suri to give us the backstory that led to the inception and the formation of this initiative.
Thank you, Sanjay. A big warm welcome to you all. And it is amazing that you could join us on a busy Monday. My name is Shubhada Suri. I'm going to tell you in brief what inspired us to do the Prem Seva project and launch it today. Today is the birth anniversary of my late mother-in-law, Dr. Mrs. Prem Suri, who we call Mummy, and she would have been 90 today. She was a lady with multiple talents. She was a good singer. She was very skilled at knitting and sewing, and a great cook too. But most of all, she was a dedicated doctor who looked after her patients meticulously. Ironically, she herself developed a nasty pressure sore towards the end of her life. She lived at home with my brother-in-law and sister-in-law, who looked after her in the best possible way. However, we found that the paid carers were lacking in basic knowledge in caring skills. We also found it difficult to find practical information relating to caring for a senior person at home in one place or on one platform. Sadly, Mummy passed away during COVID, though not due to COVID. We had similar experiences regarding care of our aunts and other relatives from both sides of the family. And that is where this idea was born. We did a short survey with friends and acquaintances, which confirmed that they had also faced these issues. Here is our attempt to provide basic practical information through this website and app, and we hope it will empower families to care for their senior relatives at home, along with the help of paid carers in the best possible way. Mummy's name was Prem, so we have called this project Prem Seva, Service with Love. Projects like these only come together with the help of many, and we are incredibly grateful to our family, friends, and colleagues who have graciously given of their time and expertise in many different ways, including advice, encouragement, editing care sheets, creating videos, critiquing, and spreading the word. Even my 90-year-old mother, who's in the audience and aging gracefully, has helped with translation, video, and even modeled for the app with my nieces. I'm going to stop now, as we have a lot of interesting things to listen to. Thank you, and over to Sanjay.
Thank you so much, Shubda, for that lovely introduction and giving the backstory and giving us some details about Mum. I'd now like to invite Dr. Nilima Kadambi, and just like to say at the outset how fortunate we are to have connected. We have known Dr. Nilima for many, many years, but it was in the context of almost like a throwaway conversation we had many years ago that I remembered that she was so passionate about care for senior people in India, and that's how I reached out to her. And she's been with us with her commitment and her unfading enthusiasm. I'd really like to listen to what she has to say about home care in India.
Namaste
Nilima.
to everybody in this audience. And thank you, Shubda and Sanjay, for making me a part of your Prem Seva journey. Everyone will agree that the need for trained caregivers is far higher than the supply chain can provide in India. Though as a percentage, the Indian population may have a small percentage of seniors and super seniors, but as a number, it's really large and growing. Even though many home care service providers and agencies have mushroomed across India to meet this demand, the quality of such care still falls far short of expectations. And if you just look at numbers, it might look like there's lots of service providers available. But if you take a satisfaction survey, it really comes out not looking so great. I can say very honestly from my personal experience that we, even though we are a family of doctors, struggle to provide optimal support to our parents during the illness in the year 2013. I now live by choice in a beautiful green retirement community called Suvidha in Bangalore, and I have observed firsthand many such recurring issues of lacunae in caregiving on a daily basis among other residents here. This situation in any family can lead to unnecessary suffering to the elderly and adds a burden of anxiety, stress, and sometimes even guilt on the caring family members. Hence, I truly believe that this initiative, Prem Seva, will be very helpful. And with Prem Seva support, some of the gaps in the skills and knowledge that exist among caregivers can be bridged. I think this is an excellent use of technology and joining of hands of various committed professionals from different parts of the world to bring together and disseminate knowledge about optimal caregiving methods and techniques. And the best part is it's available at the fingertips of the caregiver on their mobile phone as and when they need it. My prayers and best wishes to the team, and may the memory of Dr. Prem Suri be eternal through this endeavor. Thank you.
Thank you so much, Dr. Nilima, for those, once again, those kind and insightful words. I'd now like to tell you a little bit about the project. We are a little bit tight as far as time is concerned, but I will hopefully share a few slides with you, which will give you the context and give you a little bit of information about what is it that we have come up with. So we've been talking in the Indian press, there's been a lot of talk about the silver tsunami. And when I sort of read this term, it made me feel that, yes, of course, there is something about the reality of what is going to hit India soon and has already hit India in terms of numbers. But when you talk about a tsunami, you usually talk about something that is destructive. And I'm trying to think that could this be an opportunity? Could this be a wake-up call for us to say that in 2050, there's going to be a crossover. And the number of young people under the age of 14 is going to be surpassed by the number of older people over the age of 60. So this changing demographic has happened in many other countries and is soon going to happen in India. And are we prepared for it? So there are 120 million people over the age of 60 in India at the moment. So that's 10% of the population. Now, of course, any percentage of the population of India is a huge number already, but this is projected to rise to 354 million by the age of 2050. So that will be 20% of the population. So this increased longevity, whilst it's celebrated because it's due to better healthcare, even though it may not feel like on the ground, but there is definitely more healthcare, there's better healthcare reaching even the people who are poor, and the reduction in poverty and also lower birth rates. So average life expectancy in 1947, when India gained independence, was 32 years. Now it is 68 years and rising. So what is the need? Now, 82% of senior people live in their own homes, and actually a much higher percentage are actually living with somebody else who's a family member or with a relative. But 82% are actually living within the context of a joint family or some kind of a community that is looking after them. We also know that healthcare complexity is rising everywhere, all over the world, and including in India. So people are living longer with more complex difficulties. We also know that family and paid caregivers need skills and support. Nobody realizes or nobody prepares for the fact that somebody in their community or their family is going to get old, they're going to need help, and how are they going to help them? I spoke to my aunt who actually spent many years looking after her elder aunt. So these are my mum's sisters. And I asked her what was the one skill she felt that carers needed to have. And she said, if you can't teach them or show them or train them in anything else, train them in compassion. So care, compassion, communication skills, all these are absolutely vital when we're talking about dignified caring for senior people. We also need to remember caregiver well-being, because caregivers are often young people, they're usually women, they're usually doing this for money, and it's very often forgotten that their own well-being is also so important. And how we employ them, how we make them work is really in our control. We also know that medical models don't work here. So the typical data gathering, history taking, investigation, diagnosis, treatment model, which of course, as doctors, we know very well, seems to stop when the patient is discharged from hospital. And then when the patient goes home, or the elder person or senior person goes home, it's very much left to the family to work things out around how they're going to look after that person at home. So we wanted to do this really to empower families, and we felt that families have the greatest vested interest in something like this, and they would then transmit some of that information, education, and training resource to the paid carers that they employ. So another reason for the need is that children are moving away from home. We want our children to do well. We want them to fly the nest. And of course, we as children ourselves have flown the nest and gone outside the country. And this is a reality with lots of families. So the decline in joint families, a rise in nuclear families. How do we address the care needs of people as they're growing older when their immediate family are not in the same city or the same country? We've already talked about paid caregivers not having the skills. And one of the things that has really struck me is that the expertise around care And this is also true for nursing care. It's not only the care at home. The expertise around nursing care and care at home has not kept pace with medical expertise in India. We know that in India, you can get all the latest investigations and indeed treatments that are available in the rest of the world. But I think we need to be a little bit more ambitious and aspire for the same care that some of the other developed countries of the world are aspiring to, or indeed have with them at the moment. Now, I must say that there have been a lot of initiatives by the Indian government to address this issue. There are lots of reports that are coming out. There is the India Aging Report that came out in 2017. There's a longitudinal aging study in India that came out in 2020 based on some work that was done in 2017 to 2018. And these documents I do feel that there is...
Sorry to interrupt, Sanjay.
Sorry.
Dr. Madhuri Kanetkar, our guest of honor, has just joined. You can welcome her and make her the co-host.
Yeah, excellent. Thank you so much, Nilima. I will do that. Just stopping the share. And hello, Honorable Vice Chancellor, Madhuri Ma'am, Dr. Madhuri Ma'am. Thank you so much for joining and taking the time out of your busy schedule. We've just started and I just resumed my presentation, but I just wanted to take the time to welcome you.
I'll firstly apologize. I had to literally run out from the same, got into the car. But this is a very important thing. And thank you so much. And I apologize to all who logged in and had to wait for me to come in.
No problem at all. I was just saying, Dr. Madhuri Ma'am, that we have had a couple of reports. There have been lots of reports, but these are the ones that struck out for me, that there has been some attempt to try and understand what aging means for India. And I know that there have been a lot of initiatives that are underway, both in the sort of government sector and the private sector. There are lots of private initiatives, of course, mostly around care homes, but we're not talking here about care homes. The Prem Seva project is about home care. It's about empowering families, about supporting families at home when they find themselves in this situation. They're looking after a senior person at home, and there's no support, there's no advice, and there's nobody to tell them what to do, how to do it, where to look, and who to turn to for support. The incidence of disability. Now, disability is defined as any senior person needing support in the form of their activities of daily living. And there's something called instrumental activities of daily living, which means that they are needing support, which requires some kind of intervention, some kind of a device is required. And it doesn't have to be a very complex, it could be just a wheelchair, but that is called IADL. And if you read the documents, you will see that there is quite a lot of detail gone into. Now, some of this is ascertained, I think. We don't have all the figures, but we can see that after the age of 60, and the men and women are very, very similar in their percentages, the incidence of disability in people, senior people, rises quite dramatically. So by the time people reach the 80s, and fortunately, at the moment, there are not very many people in the 80s. I'm saying fortunately only because we don't have the resources at the moment to look after people who are much older. But given the fullness of time, I think we need to be able to help people even as they're getting even in their 80s and their 90s. So we do need that. We do need to understand that there is going to be an increasing requirement for this. So what is Prem Seva, and what is Prem Seva hoping to address? So Prem Seva is an online information and education resource. We have a website, which please feel free to log on to the website. It's up and running. The apps are still awaiting approval. They are ready, but you may have some difficulty getting onto the app. If you've been able to successfully get onto the app, that's brilliant. The app and the website mirror one another. And what we've tried to do is have resources available that will help you provide practical and compassionate care for senior people at home. So I'll just stop the share now and just share another poll with you, where just to get a sense of senior home care. And you'll see a question arising on your screens. If you please answer that.
I think we have a very alert and interactive audience today.
It looks excellent. Yeah. About 2/3 of you have participated. Fantastic. So keep going. Let's see if we can get the number a little bit higher. Okay, so we've got about 3/4 of you participated. I'm going to end the poll and share the results with you. So you should be able to see this. So the question, have you employed paid carers to help you look after a senior person in India? 51% said yes, and 24% said no. So we've got a good majority there. And have you accessed web-based information about caring for a senior person at home in India? 22% said yes, and 56% said no. So that is really, really interesting. Thank you so much for taking part. So I'm just going to go back to the presentation. So I'd just like to also say what Prem Seva is not, because I've been asked this question a few times. Are we going to provide medical information? So it's very clearly not a medical information app. So because there are loads of medical information apps available, people have greater access to family doctors, specialists in India, and medical information is more easily available. So this is not medical information. And of course, there can be an overlap, but we very much are talking about care at home here. It is not a substitute for actual physical nursing or medical care. We are not a home care service provider, as a lot of excellent organizations in the country have come into the sector and are providing home care services. We are not currently providing any caregiver certification. We may go on to providing a formal training program, but that's not what we are doing right now. We are not providing non-healthcare advice. So advice around financial planning, the loads of places where people can go to help senior people understand about banking, about finances, and about other areas of need and help, which are equally important. And we are not a commercial enterprise for profit. So what is the app design? The app and the website mirror one another. The central feature is the care plan approach. And in a video that we've recorded, which will be following my talk, we are going to be showing you how to design a care plan for a senior person. There's also some information available on the homepage. The main features are divided up into care sheets and care videos. And the care sheets are to provide information, the care videos are to demonstrate practical skills, and the care plan is to provide a personalized approach to the senior person that you look after. We've divided care categories into healthcare, environment, equipment, social needs, and miscellaneous. And these areas have not yet been fully populated. It is work in progress. But as we go through, and especially as we get feedback from you, we're going to keep adding to the content of the website and the app. We're also going to design a forum to build a community of support, because one of the things that we realize is that people in caring roles feel that they are alone. They feel that they are the only people who are struggling with the issues that they're struggling with. And it would be great if they could have a platform where they could share some of their difficulties and their problems, and also their solutions with one another. So what happens next? So what we are going to do next is do some social media marketing. So we already have a presence on LinkedIn, on Facebook, on Instagram. We are going to have cards of this type that you can see on the screen, very, very simple cards with the website on it, for perhaps hospitals to use when they're discharging people above the age of 60. And if it is of relevance to that particular person, the families may want to log in and try and see if there is some resource on Prem Seva that might be able to help them. On the website, there's a Google Translate button on top. You can see it with a little translate icon, and you can tap that and you can translate the Prem Seva pages into the language of your preference. And we are going to be, we've subtitled the care plan video. We're going to subtitle all the other videos where you can choose the language that you would like to have in the subtitle. And of course, we really welcome people using the app and the website, giving us ideas, collaborating with us so that we can improve this product as we go through. So thank you so much for listening. And I'll now move on to share with you a website and app demonstration by Dr. Tijo Thomas and Dr. Shubhada Suri. So just like you two, I know that Dr. Tijo is going to introduce himself as well, but Dr. Tijo Thomas has been, once again, he was introduced to us by Dr. Nilima. He's been with us right since the inception of this project, and he's been an amazing help. He is one of the rare doctors who is great at being a doctor and great at understanding information technology. So he's been such an asset.
Good morning to our well-wishers in the UK and good afternoon to
Great.
the folks in India.
It's fine.
Welcome
Yeah.
to a demonstration of the Prem Seva website and app. Many of you might be wondering who this chap is. Let me introduce myself. My name is Dr. Tijo Thomas and I'm a junior resident doctor working in the St. John's National Academy of Health Sciences, Bangalore. I've had the privilege to be associated with Prem Seva right from the beginning, and I've seen how a baby idea has grown over 2 years into a healthy child. That is the app and website. I was introduced by Dr. Nilima to Dr. Sanjay and Dr. Shubhada in 2021, and ever since then, the passion for healthcare for senior people have kept us all on board. We've always emphasized on 3 key elements when we built Prem Seva with Basic Limited, which are ease of use, simple design, and cross-platform compatibility. And hence, to accommodate all these, we have come up with a simple yet a robust app and website, which is available from PC to your phones and is constantly being improvised to keep it easy to use. For demonstration, I'll be using the website, but be rest assured the website and the mobile application mirrors each other.
For starters, let me just show you how to access Prem Seva on respective platforms. On any device such as your PC, open the browser such as Chrome or Safari and type www.premseva.com into your address bar. Once you scroll down on the home page, you will see buttons for app downloads on the App Store for iPhones and Play Store for Android phones. We are in the test phase and have rolled out test versions of the app, but we'll be up on both platforms for everyone very soon. Meanwhile, you can access Prem Seva on the website as it mirrors the app. The homepage has 2 videos and I suggest you to watch them at the beginning. The first video is an introductory one where Dr. Sanjay and Dr. Shubhada speak about Prem Seva. And in the second video, Dr. Shubhada explained how to create a care plan for a senior person on the app. We can also read the transcript of the 2 videos right below it. We also have a translate button on the top right that makes premseva.com accessible in most regional Indian languages in addition to English. At the bottom of your screen, you'll see a bottom navigation bar which will be visible on your screen throughout. As the name suggests, it is for easy navigation and it can quickly take you to home page, care sheets, care videos, and care plan at the click of a button. When you are on a specific section, for example care sheet, that gets highlighted in sky blue and you get to know where you are on the app currently. The button on the right with 3 horizontal lines is called the hamburger menu, and you can find all essential settings related to the app here. If you haven't logged in, you will only see a few options. So let us log in first. And if you are a first-time user, you will have to register. The conventional method is to type in your email ID, name, and set a password. But if you want a quicker and easier method, you can log in with Google or register with Google. This will help you sign in with the Google account that you have set up on your device. Since I have already registered, I will log in with Google. This will automatically enter the Google sign-in details I've used on the same device. I've already logged in. Now let's go over the hamburger menu options. First, you will see profile. You will need to set up the profile of the caregiver and the care receiver. As the name suggests, these are profiles of the person who is giving care. Here you will have to enter your name, age, gender, and the relationship with the care receiver. Similarly, there is a profile for care receiver. Here you will have to enter the details such as the name, age, how the person would like to be addressed, their picture, their preferences, and submit to create the profile. Next, we have bookmarks. This is where you will find the care sheets and care videos that you bookmarked and kept for quick access. More on this when we go over the care sheet and care videos. We also have the feedback button. This will take you to a form through which you can let us know specific feedback. Please use this as we can only improve the app with your feedback. We also have a forum which is not up yet, but this is where you can interact with other users, discuss similar doubts or situation, and benefit from these discussions. It will also help build a community and a sense of togetherness, which will help you face the difficulties in a better way. The Contact Us button will take you to our official mail ID, which is premsevateam@gmail.com, where you can correspond with us. We also have the settings. Here you will find two basic options, which is change your password and delete your account. Now to the main features of the app, which are the care sheets for information, care videos for practical skills, and care plan for personalization. As you can see, there are 5 main categories in which we have subdivided the care sheets, namely healthcare, equipment, environment, social needs, and miscellaneous. One thing to note is that the bookmarked items also will be categorized according to the same subcategories. Let's see what's there in healthcare. There are a wide range of topics such as eye care, mobility, and nutrition. And now, when we open Mobility Care Sheet, we can see the information laid out systematically in very simple language. And you can see a bookmark button at the top too. When you click this, it will save to the bookmarks, which is accessible from the hamburger menu. When we scroll down, we can also see a video demonstrating how to help a senior person in and out of the bed. This is shown here as its a relevant care video. This can also be accessed separately through Care Videos tab. Links to other relevant resources, care videos, and care sheets have also been incorporated at the bottom for ease of access. On to the second most important feature now. This also follows the same categories, and you can find very useful demonstration of certain key aspects of care skillfully performed by the staff of Rotherham NHS Foundation Trust and several other videos from external resources which we found useful. You can watch its care videos from within the app, and you can bookmark it as well. In the miscellaneous subcategory, you can see several other videos, such as an introduction video by Dr. Sanjay Suri and Dr. Shubhra Suri, a message from the family, and a video on how to create a care plan. We plan to incorporate subtitles in regional Indian languages to all our videos. We started with the video on how to create a care plan. You can change the subtitle by clicking the settings gear icon at the bottom of the screen and click on subtitles. Now you can choose the regional language of your choice, say for example Hindi, and the video subtitle will start to appear in Hindi. This will be useful for people who are not comfortable with English. Now, moving to Care Plan. This is one of the most important features of the app, and I hand over to Dr. Shubhra Suri for taking you all through Care Plan. Over to you, ma'am.
Thank you, Dr. Tijo. I'm going to briefly orient you to the care plan section. This is the care receiver page, which has been accessed from the hamburger menu. I've called my care receiver Ajji, which means grandma in Marathi. I've populated the care plan with fictitious details for purposes of demonstration. Now tap the Go to Care Plan button. It will bring you to the care plan page. There are 20 questions here which address the important care needs of a senior person. You can use the pencil icon to start answering the questions as best as you can. For example, this is question 1, which asks about Ajji's level of understanding. You can enter reduced understanding
and additional details in the comments box, such as speak slowly and clearly. You may need to repeat your instructions. You can go through the series of questions, and at the end of the 20th question, you can save the care plan. You can review and edit the care plan at any point. The generated care plan will look like this. Each answer has a care sheet associated with it and can be accessed by clicking the dark blue color button. The care sheet will inform and educate you about the content related to that question. For example, the care sheet for the first question discusses assessing understanding. You can print your care plan once completed. When you tap on the print button, the care plan will come to you as an email attachment to your registered email ID, from which you can print it out. For further details regarding the care plan, please watch the care plan video on the website or app. Thank you.
Great. Thank you so much, Shubhda, for taking us through that. I'm just going to go back to the presentation. Okay, I would now like to invite Dr. Shubhda Suri to kindly welcome our guest of honor, Lieutenant General Dr. Madhuri Kanitkar, Vice Chancellor, Maharashtra University of Medical Sciences. So over to Shubhda to welcome Dr. Madhuri, ma'am.
Thank you, Sanjay. I'm delighted to introduce Vice Chancellor, Lieutenant General Dr. Madhuri Kanitkar, madam. We are so glad you could join us. I remember seeing Madhuri ma'am as a fellow medical student over 40 years back when she visited BJ Medical College to meet her sister, Dr. Nilima. And wow, what an illustrious career she's had. Madhuri ma'am has had a brilliant academic record, followed by a career as a doctor, an army officer, rising to the rank of a general, an inspiring teacher, an innovator, and also a scientific researcher. She has held and continues to hold high positions of responsibility and leadership. Madhuri ma'am is also a sportswoman and an academician, besides being a loving wife, a dutiful mother, and a doting grandmother. Highlights of her achievements are visible on your screens. I now call upon Madhuri ma'am to share her thoughts about senior care in India, and we welcome her suggestions and guidance to Prem Seva team. Thank you, ma'am.
Wow. At the outset, Dr. Sanjay, Dr. Shubhda, the board members, trustees, Professor Bowman, and Dr. Tiju, and all the members who've made this thing possible. I'll start with my big compliments for a great initiative from your part. But before I move on to that, I myself would like to pay my respects to Dr. Prem Suri, who I was a physician and would have been 90 today. You couldn't have chosen a more auspicious way of paying your regards to a lady who given her life for medical care and so many things in this noble profession. And I think as children, she must be feeling very proud from heaven to have children who continue to take her prophecy forward. As far as this initiative goes, I think it's really time. Just today, in fact, I am driving out of the Raj Bhavan, where our Honorable Prime Minister has launched today a nationwide mission called Viksit Bharat at 2047. Now, how is this related to this Prem Seva app is something I'd like to share with you. If we look at the demographics, today, India is the most populous country, and we are lucky today to have a population where 65% is below 35 years of age, and 22% of our population are adolescents. But having said that, the world is moving towards an aging population. And India has worked out that till 2047, that is, we have just 24 years before this human resource value that we have of young population is going to start coming downwards. But having said that, we would be the providers of healthcare personnel for the world. So therefore, what I spoke on even at Raj Bhavan was that India for the world, India in the world, India to lead the world for healthcare. And that is particularly for your aged population, the people with disabilities. I would like to add Alzheimer's, degenerative disorders, even in younger people who need full-time attendance and care. So it's a win-win situation. Thing why this is important even for India is that we have moved away from the joint families to nuclear families. Children have moved out and are moving to larger cities or other countries overseas for jobs, for work, much as they would like to be with their parents, and the parents like to have their children around, it's not possible. So in those situations, you totally rely on healthcare professionals and health attendants, and no elderly would like to be in a care facility if he can get the care in his or her own home environment. And I think that's where Prem Seva steps in, because very nicely, while Tiju walked us through that easy to use application and website and the ability to have a language translation, it would be applicable to everyone. And this would help and empower the caretakers, because very often even home people are very skeptical about taking an elderly person home from hospital, and they would like, just for want of this kind of care, there is a hesitancy, there is a fear among the non-healthcare professionals as to how are we going to care for the elderly or the bedridden once we get them home. And it actually doesn't require doctors and fully trained nurses for home care. We need someone to empower them. We need someone to handhold them and to take them forward. So I see that Prem Seva would be useful to, like you said, for hospitals during discharges. If this can be, awareness improved, that people can download and start using it and feel confident. And then before going home, they can even discuss with their own specialists, doctors, nurses, if they have doubts, or they could, communicate with team people to kind of take areas which are not very clear. The second aspect, which I thought as an educator and a vice chancellor of a health university, which is looking forward to skilling young people beyond medical and paramedic care. Those are the structured courses we're already running. But now we are looking at skilling youth to be able to get this job with a confidence. Today, the attendants which come, there are two groups. One, which come through middlemen who are bureau agents and they provide, but they are not fully trained. And they tend to then kind of make the middle money, whereas the actual attendant gets just half the money. So instead of that, if these healthcare attendants felt comfortable and this app could later develop, I mean, I'm giving a future thing, that it also has matching up people that, like any other service provider. I mean, you're just linking up people who link up with you, who there is a system of accrediting them and saying that, yes, these people are now confident. They've gone through, they could even go through a self-test, something like that. And then you match up a service provider who has gone through the steps of Prem Seva with a person who needs that service. So the person seeking the service also feels confident that, yes, this person has a tool, a weapon, something that they can use in times of need and are not totally unsupported. So I thought this was another way that this can be very, very useful. And I once again really compliment you all that we are producing these kind of applications which help take home care to the home. It would make elderly comfortable And I'm sure I won't be surprised if we have elderly people also logging in to say it's taking care of. Are they being able to give us the kind the way India with its digital health mission is going forward. And we are so proud to have had, whether it was the COVID app, whether it's our UPI, just use of data and the cheapest available data and apps which take education and empower the common man. So, I mean, it's a win-win situation, and Prem Seva is going to, Prem is for love, of labor, going to get Seva or
A slight technical
society
challenge
to the
because of the travel,
communities,
I suppose. Voice is sometimes breaking up.
all
Yeah.
the others. So once again, I compliment you all for developing this. I wish the app the very best, and particularly to Dr. Sanjay and Shubhada, if you do visit Nasik, please come and see how we can take this forward into a even more next level of accreditation. Can it be run through an LMS? Could we sort of take things further? Because this is the need of the hour. Thank you so much. Jai Hind. God bless you.
Great. Thank you so much, Madhuri ma'am, for taking the time. And I know it's been so difficult for you to try and juggle your various appointments and schedules. We will take you up on the offer because we actually are Nasikites. We live in Nasik, so we'll be knocking on your door soon. Thank you so much for joining. I'm just going to unmute or allow people to unmute themselves so that you can give a round of applause that this app and website has now been formally launched. You can use the reactions button to give us a wave, give us a thumbs up, or whatever else you can do within the limits of Zoom. I don't know, are you able to unmute yourself?
Everybody can unmute themselves and say 3 cheers for Prem Seva. Hip hip.
Hooray!
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 That's great. Thank you so much. Now, one of the things I'd like to do now is that we did have a Q&A session, but we are running out of time, and I really would like to go to the vote of thanks. That doesn't mean the session is over. We will come back to Q&A, and so please bear with us and stay with us. I know that we have already spent an hour on this event, but I would really like to thank, you might be wondering, so how did this app happen? How did this website get developed? And we've worked very closely and for a very long time with Abhimanyu and his team at BizTech Limited, Mohan and his team at SGV Softtech, and we've had multiple meetings. And it's a case of, I have learned such a lot about apps and websites, and I'm sure they have learned a lot about senior care just through the course of our conversations. I'd like to thank Rotherham Foundation Trust for being so generous with the clinical skills suite, with their staff, and with the videographer. That's the only way in which we've been able to produce these videos at literally on a shoestring budget. I'd like to thank my cousin, Mr. Sailendra Sharma and Mrs. Kirti Sharma in California. They have been our software consultants, and they've been able to, I suppose, help us with the complexity. I mean, it may look like a very simple app. There are very few functionalities to it at the moment, but it has the potential to expand and grow into something really big. And that's because we've had the right type of advice. We've had lots of enablers. I'd like to thank the audience for joining today, thank all the caregivers, people who are involved with care, and once again, thank the Honorary Vice Chancellor, Lieutenant General Dr. Madhuri Kanitkar, for giving us her time and her useful words of advice. And it'll be really great to meet you, ma'am, at some point. Thank you to Professor Clive Bowman, once again, for his generosity. The advisory board members, Dr. Nilima Kadambi has been with us right since the outset. Dr. Tijo Thomas has been with us right since the outset. Dr. Sadia Ismail, she's been with us right since the outset. Dr. Bijoy Mandal is our mentor. Dr. Ravi Karwa has contributed immensely through a yoga video. Dr. Daryl Brito has contributed by talking about mental health. Dr. Sangam Malani, Brigadier Mala Singh, who is a retired head of nursing at Armed Forces Medical College. Patrons in India is my brother, Colonel Y.V. Suri and Mrs. Darshika Suri, who've been actually the people who've looked after my mum when she was in the last few months of her life, when she actually needed that intensive family caring for her. Dr. Priyadarshini Kulkarni, who has looked at many of our care sheets from Symbiosis University and Medical College. So I'd like to go now. I'm sorry I've done it backwards and forwards because I really wanted people to hear the list of people that we are indebted to. And I'm sure I've missed somebody out, but I'm really sorry about that. But please take yourself as being the recipient of this gratitude. So just going back to the question and answer session. So I'd now like to invite Shubhada, Dr. Shubhada, to tell us a little bit about what kind of themes have come up in chat, what kind of questions have you asked, any comments that have come through. But you can always contact us on the email address that's at the bottom of every slide, premsevateam@gmail.com, and we'd love to hear from you about how we can take this forward. I mean, this is a newborn baby. The Prem Seva is a newborn baby and has immense potential. So, and it's great to have you on board. So anything you'd like me to address or any of our team to address?
Thank you, Sanjay. There are many, there are lovely comments from friends and family and all the attendees. So thank you very much for that. There aren't any particular questions on the chat box, but there have been some questions which have been asked before. One of them was, will there be virtual consultation on the app in future? So maybe you want to take that on.
So, sorry, I'm just going to go into gallery view because I'd just like to see who all are present. Excellent. Yes, so virtual consultations is not a functionality of the app and the website at the moment. That doesn't mean that it's not going to be in the future. We really want to see for the next 6 months how this app lands, what families think of it. We want to encourage people to use it and not just browse it, but actually register yourself, enter the caregiver details, enter the care receiver details, design a care plan, and then we can then start to see what the need is. And on that basis, people might well come and say that, you know, okay, fine, you've given us this app, but what we really want is, what do I do now because this has happened? Or what do I do now because something else has happened, something I wasn't anticipating? And I must say that that would be an absolute ideal service, but at the moment, we don't have that functionality.
Thank you. And just another question, will there...
Sorry, Shubha, I missed that. I missed a bit of that.
Will there be cost for use of this app in future?
Okay, so currently the app is going to be rolled out at no cost. There is, as you must have seen that on the hamburger menu, there is a subscription button. There's a plan that in 6 months' time, we will have a subscription model. The subscription will probably be a nominal subscription, or there may be a series of different types of plans. There may be a basic subscription model. There may be a premium subscription model based on what kind of unlocking sort of mechanisms are required. But really, this is something that we want to make available as widely as possible. So the other aspect of kind of an app like this is not going to just run on love and fresh air. It's going to need funding. So we will need sponsorship. We will perhaps need to do fundraising and perhaps need some kind of investment from people who feel passionate and committed to it. So that would be the mechanism by which, and I'm hoping that we can keep the app very, very low in cost or free at the point of delivery.
Yeah, so just one more question coming in. Maybe that's the last question we can take in terms of time. From Dr. Ravi Mahajan, is there any potential in tying up with home care medical teams that are emerging in the Indian market?
Yeah, absolutely. Any sort of collaboration will be welcome. And I'd really like to hear from, especially, we are based in the UK. A lot of you are based in India. You understand the Indian situation much better. And also the emerging Indian situation. India is changing so rapidly. the India that we left behind even a year ago was probably changed already. So yeah, we welcome collaboration.
I had a small question, more
Sure.
for Tiju, I guess, saying that many of the caregivers in India are not highly educated people. And if they have technical challenges while accessing this information, will there be some tech support or troubleshooting?
As of now, they can contact us through our official mail ID and we'll get back to them personally.
Thank you. I think it was a lovely launch ceremony. And thank you, Shubda and Sanjay, for conducting it. And may the memory of your mother stay with all of us with this app.
Thank you so much, guys, for joining us. And I'm sorry we ran over time, but it'd be lovely to hear from some of you once again. And once again, thank you so much to the Honorable Vice Chancellor, Dr. Madhuri ma'am, for joining us. Thank you. I'll call an end to the meeting now. Thank you so much.